Hi, my name's Chelsia Gillis. I'm an assistant professor in the School of Human Nutrition and associate member of surgery and anesthesia at McGill University. I'm a Canada Research Chair, Tier 2 in Perioperative Nutrition, and I'm the research director of the Perioperative program.
Why is improving surgical outcomes a critical priority in modern healthcare, and how can students contribute to this field?
More than 1 million inpatient surgical procedures are performed in Canada annually. Elective surgery can save lives, reduce disease burden, and healthcare costs. However, surgery carries significant risk for patients, particularly those who are malnourished, frail, or living with chronic disease. Let me give you an example. Surgical outcomes are a product of good surgical care and patient factors. While advances in surgical care have improved outcomes, post-surgery complications remain high. This was demonstrated in a large prospective multi-site cohort of nearly 16,000 colectomies, in which patient-related factors, and these are things like uncontrolled diabetes or smoking, contributed 8-fold more to the development of complications after surgery than surgeon and hospital-level factors. Now, this tells us that pre-surgery optimization may be key to improving outcomes. Yet historically, surgical programs have paid little attention to the preoperative condition of the patient. Students can certainly contribute to this growing field by enrolling in graduate studies to investigate which preoperative interventions work best, how they work, and for whom they work best, so we can improve patient outcomes.
What opportunities do students have to learn and apply advanced research methodologies in evaluating surgical care?
McGill, we have what I think is the first prehabilitation clinic in the world. At the Montreal General Hospital, we have a clinical service where patients can be referred by their surgeons, and connected to this clinical service, we have my lab, the Prehab lab, where we conduct preoperative research. This combined space allows us to conduct clinically relevant studies that can be immediately translated into practice. Our work is multidisciplinary and transdisciplinary. We work with anesthesia, surgery, nutrition, and exercise departments, as well as with basic scientists, mixed methods, and behavioral scientists. And now I currently have students conducting trials related to the extent to which exercise enhances surgical outcomes in frail and malnourished patients with cancer, in feasibility work on improving preoperative glycemia, and a study on understanding which preoperative characteristics predict successful same-day discharge for colorectal surgery.
Can you share an example of how surgical outcomes research has improved patient care and the role students played in that success?
We recently conducted a feasibility study for Prehabilitation, which is preoperative optimization, and this was for the purpose of enhancing access to our clinical service. This is a really important initiative to ensure care is equitable. We found that Prehabilitation was feasible. Patients were able to exercise from home. They followed the nutrition prescription. Actually, adherence was better than any other study we conducted in person. Patients appreciated the virtual support, and the postoperative results were similar to that of our in-person studies. 2 students participated in this project by helping with data collection, analysis, and writing the results. These students were co-authors on the paper, and the lead author won a prize at the Canadian Nutrition Society. Most importantly, though, these students contributed to improving health equity. With tele-prehab, we can now reach patients who can't make hospital appointments because they live far away, they have busy jobs, or mobility issues.
How does studying surgical outcomes prepare students for impactful careers in clinical research, policymaking, or healthcare innovation?
Studying surgical outcomes gives students the perspective of real-world healthcare challenges, how to measure it and improve it. It's where clinical decision-making, patient experience, and system-level issues intersect. It builds skills that are directly transferable to clinical research, policymaking, and healthcare innovation. With our surgical outcomes research program, we aim to develop critical thinkers who can ask meaningful questions, design high-quality studies with low risk of bias, and work across disciplines to drive clinical change.
Finally, do you have any messages to prospective students who would be interested in joining the program you would like to share?
I hope that prospective students will want to join my lab. I think that prehabilitation in particular, which is what I study, is a really exciting growing field, and I hope that prospective students will consider a research career in surgical outcomes, and in particular preoperative surgical outcomes, which I think is really exciting and maybe even the next frontier of surgical advancement. I mean, some other people might argue with that, but I think it could be really exciting and they could be at the forefront of it. So what I do actually is when people reach out to me, I have them come to, we call it pop rounds, perioperative program. So I have them come to pop rounds and present. And then we get a sense of their communication skills and we ask them questions to get a sense of their critical thinking skills. And so that's like a little test that we do in my lab. So that's what I'm looking for. Good communicators, people who are organized, able to put together a research design with some guidance and support and can think on their feet.